Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron, and I'm here to bring you cutting-edge insights and practical strategies from leading healthcare experts for your journey to prime health in life and in business. Now, most people don't feel as though they're heard in the doctor's office, and that's something to know about our guest today, Dr. Ryan Tomlins, is that he wanted to change that. So he built an entire practice around listening first and treating second. And I know we're all going to want to hear about that. Before we jump into the episode with Dr. Tomlins, though, I have a quick message from our sponsor, Growth Solutions. We are your growth partner that turns your healthcare expertise into market leadership and business growth one strategic move at a time. So Growth Solutions is not an agency or vendor. We are your growth partner, and we take a diagnostic approach to your business. We analyze where time, money, leads, or opportunities may be leaking. We help eliminate stressors in the business, such as new patient or client acquisition, marketing and growth strategies, reducing operational chaos with proven systems and SOPs, and then understanding which AI system and agents implement, because those robots are coming for us whether we like it or not. So if you ever thought this, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we are your solution. So if you're interested in a free growth consultation, just drop the word grow in below, or feel free to reach out to me on any platform that's out there. But you came here, and that is to meet our guest. So let's dive in with Dr. Tomlins. Again, Dr. Tomlins, welcome to the Prime Health Podcast. Please tell us a little bit about yourself and what you do.
Yeah, thanks, Dr. Byrne. Really excited. I love talking about healthcare and spreading the message of how we can improve our own health and our healthcare system really in general. So, I grew up in Kansas. I'm a Midwest kind of guy, lover of sports, which led me down to pursuing a sports fellowship. So I did a primary care residency in family medicine, really with an intent to get to sports medicine. There's a few different ways to do it. ER, family are the two things I applied for. Ended up just matching in family. So I did that in South Carolina, and then was lucky enough to do my sports fellowship in Alabama with the Dr. Andrews Institute. And Dr. Jeff Dugas was my mentor, amazing teacher. And, that place is just all ortho, all sports, all day. Learned a ton, and then ventured out, joined another physician in Atlanta for a few years, practicing like non-surgical ortho, sports med. But I've always had this interest in functional medicine and alternative medicine, or whatever term you want to use, mostly from my dad, who was a chiropractor who practiced a fair amount of those things growing up. Just asking the question, why do we do that? Why do we test that way? Are there simpler things we can implement other than just medication stuff? And then moved back to Kansas about 10 years ago to take a team physician role for the college that I played basketball at, which was kind of interesting and fun. Then just kind of grew a little tired of the corporate and hospital system and the insurance stuff a little bit, and kind of made the leap about 2.5 years ago now, 3 years ago, to start the business and, get out of that just kind of day-to-day, room to room. We talk about listening, and that's such a big thing. And that's just hard to do when you have 5 minutes in the room with somebody. You're seeing 30 people a day. And you could just tell, like, a lot of folks, I tried to spend some time. You don't want to get too far behind, of course, but you also want to have them be heard. And so when I started this Summit Health in Kansas, a functional practice, and still do a little bit of sports med, maybe 10-15% of the stuff we still do with injections and PRP and orthobiologics and injuries from kids that I had seen before. It was, how do we make these appointments to where people can actually be heard? Because that's one of the things we hear about is like, nobody ever listened to me. And so that was really one of the main priorities of getting those things set to where we could provide the time to listen to people and their concerns, and come up with a plan from a functional standpoint. So that's kind of where we are now. My personal journey started like about five and a half years ago, right around during the COVID time, where I kind of got into some fasting, and then it's just been a snowball from there as far as the learning for functional medicine, and growing that knowledge, and just trying to take a different approach that feels more like medicine than order, test, write prescription. So we have that discussion a lot with people in our office. So that's kind of where we're at now. We're growing. We just moved into a new office location that will help us provide some additional services we couldn't have before, and just keep spreading the message.
Yeah. Well, you have an interesting start, it sounds like, as to what you said. I ask everybody this question: was there a moment in time that got you into healthcare? And I'm sure that kind of not quite following your father's footsteps, but being around it a lot. So what was a trigger, you not following your dad into chiropractic, or you choosing medicine? Was there a reason?
Yeah, that's a good question. It's something I thought about. I knew I wanted to do healthcare, and really a sports
Yeah.
perspective. So I shadowed some orthopedic docs in high school, and of course my dad was around, and thought about that. Even thought about podiatry at one point, but just kind of ended up going down the medicine route. I knew kind of didn't want to necessarily be a surgeon when I was going through med school, from the call and some of the other requirements that come with that.
Yeah.
So the non-surgical sports was kind of a nice way to balance both of those kind of things. I think the primary care is a little bit more down my personality, and kind of this whole person kind of concept.
Yeah.
But that aha moment was really back in about 2020 for me, and had some personal health things kind of pop up. Always thought I took pretty good care of myself, athlete growing up, multiple sports, played basketball in college, and around that time just really fatigued, kind of really before, like, I wasn't sick with COVID or anything like that, but could hardly even walk up a couple flights of stairs, and just not a normal thing for me. And so I did kind of some initial testing, blood work, all that was normal. Thought maybe it was like sleep apnea stuff. So when I got tested, had some like moderate sleep apnea. So I wore the CPAP for like 6 months, which was awful.
Yeah.
But then didn't feel any better after, being pretty consistent with that. Some people, it's the next day or two, they wake up and they're just a different person. They just, it's amazing. But I didn't feel any better. And that's what kind of led me down some of the hormones and some of the more functional related stuff. And so I went and saw a provider in Florida, actually, and all my stuff was just off the charts low. I was 40 at the time.
Wow.
And we think it's a 40 and over problem, but as I'll tell you, it's not. It's 30s and even upper 20s. We have some folks. But really within 5 weeks of kind of starting some replacement therapies and some other things, like, it definitely shifted. The brain fog started to go, fatigue got better. And so that was kind of that, like, okay, this is really interesting. Why do we not do these things? And kind of snowballed into more interest, and me myself being the patient a little bit as well, and learning some things about hormones and gut health and all those kind of things. So that's kind of where we're at now.
Yeah. You hit on something at the start, and it's about time. Time with patients, and being in a corporate structure, it's always difficult. And then even just from your personal explanation that you're going through right now, Dr. Tomlins, there's no way, if you were your own physician, there's no way you could have dug deep into your problem in 5 to 7 minutes. You just can't.
Yeah.
And there's many great physicians that are out there that are afraid to take the leap. I don't think that's you. Well, it isn't, because you took that leap, and it made the change for your better and for your patients.
Yeah. I mean, it took me a while to make the leap. You see it in healthcare, the hospitals kind of buying up a lot of private practices, insurance reimbursement going down, premiums going up, all those kind of things that make private practices tough to sustain. And so there's that bit of a security blanket that you have with the salary and in those kind of systems. But there's also pros and cons to each scenario. But the time thing is is such a tough thing. And so, we spend like on our first visit, we scheduled 2 hours for this kind of base camp, we call it, because we have to dive in and ask about a lot of different things that tie in. A lot of people might come with fatigue or brain fog. That's certainly one of the more common ones we get approached with. But there's so many things that contribute to that, and it's not this quick fix kind of thing that we're all hoping for. But we're going to ask you about your sleep. We're going to ask you about your gut health. We're going to ask about your exercise and dietary stuff and things you're taking and things you've done in the past. And to dig deep into that, to really kind of figure out things, takes some time. But sometimes the first 20 minutes, people just want to rant a little bit about what they've been asking for or haven't gotten, or I think people are becoming more aware of things. And of course, you can hop on the internet now, and there's some social media has changed a lot of things. They follow, biohackers or whoever. And so there's a lot of good information, but some bad stuff out there too, of course. And so they come with questions a lot, but sometimes it's just the rant. They need to be listened to first. We try to provide that.
Yeah, that's good. So that's basically the change from conventional medicine to functional medicine. And, I guess, what would you say for somebody that isn't sure if they want to see a functional medicine provider yet, or in kind of that alternative, not away from the hospital setting? What would you say is a way in how you could explain the difference to them, how you approach a patient versus how you would have approached a patient in the hospital setting?
Yeah, great question. I think about what I do now from a functional medicine perspective and how much of it we were trained in med school, residency, and it's got to be less than 5%. I think most functional folks would probably tell you the same thing. Now, why that is, I don't know. But there's so much more in depth. Really, the training comes down to, there's so much information to learn, of course, patterns and testing, and we kind of get tied into this numbers, like treating numbers versus the patient scenario. And, our training is to what medication can I write to make these numbers better?
Mm-hmm.
And instead of, hey, what is this person eating? How are they sleeping? Like the number of nutritional courses, most med schools is 0. I had 0 hours. A little bit of business stuff, or, just how about sleep and all those kind of things. We don't get any of that. So really the difference is most functional folks are going to be more inclined to have knowledge of that. Now, I say that with a little bit of a, bit of error in there, because like, I feel like I know a fair amount about that, but not as much as the nutritionists we use. So, like one of the things that, Dr. Andrews always used to say is like, know your limitations, surround yourself with a team that knows more than you. You always be the dumbest person in the room, right? Kind of thing. And so that's really true. So we tie those things together, but I will ask the people that work with us for their specialty because they know more than I do. And so I think when you're trying to decide that, I want patients, or what I tell them is like, ask yourself, does somebody listen to what you're saying? When you ask about a topic that might be controversial, let's just use the example, like in the cancer world, if you're asking about ivermectin or Fenbin, that comes up. But, do they just blow you off, say, oh, that's not a thing, or do they listen to you? And do they actually say, I don't know much about that, but, probably some other people that do. Are they willing to hear what you say and work with you? And we hear all the time, like I asked my doctor for a testosterone lab and they refused. They say, oh, well, you don't need that. So those are the things I like, hey, if somebody's if that's the case, probably should find another provider. It doesn't necessarily have to be a functional, just somebody that's, ingrained in your healthcare and trying to help you as much as you can.
Yeah. That's unfortunate that there are still doctors that are turning people away from that.
Yeah.
And that's basically because they don't understand. They're afraid to admit they don't know, and that's okay. And as you said, there's Dr. Google and there's Dr. AI out there right now, and then Dr. Infomercial that's on Instagram all the time saying, "I know everything." Right. You got to be careful in who you're dealing with. But when if I were to come into your clinic to get kind of a baseline health component, what kind of testing or tools do you use for your patients that come in to see you?
Yeah, it really kind of depends on what they're coming in for. So, like, one of the first questions we have, like, what do you want to get out of the appointment today? Like, what is the main goal? And we ask them for three goals. Like, what are the three biggest things you're struggling with? Fatigue, brain fog, weight, gut health. Those are probably the three or four most common things. But we go over that intake sheet and dig through it, and then we kind of formulate our testing based off of that. But certainly, most people start with blood work. We if they've had some, usually it's pretty pretty simple kind of stuff. We usually get like the same three or four labs from most people when they come, and maybe they haven't had it for a year or two. So it typically starts with some pretty in-depth lab work, different hormone panels and vitamin stuff and inflammatory markers to kind of correlate with the things they're struggling with. And then probably the next most common thing would be like gut health stuff. We do a lot of functional gut health testing. Uh, Here, the last couple months, we've been doing a lot more of the kind of nutrigenomics or the genetic testing
Okay.
to kind of see where some mutations may lie in some of these pathways to really help with more lifestyle changes, dietary changes, maybe a little bit of supplement stuff. But we kind of have this society that's like, oh, I have this mutation. MTHFR is probably the most well known, or people know that one the best, that I have to take this to fix that problem. Whereas it's not always just taking a pill for an ill, as Ben Lynch says in the book Dirty Genes, which is a great book. That really it comes down to diet and lifestyle changes. So we've been doing that a lot with folks, like the first visit, to get a baseline, like, where are you? How does that help us shape your personalized program around that diet, lifestyle, sleep, maybe a little bit of supplements that otherwise we might be guessing just a little bit. We can usually figure out foundationally what people may or may be lacking, but it just allows us another layer of personalization to your program. A lot of urine testing. We do some NAD stuff. So those are probably the more common ones we look at. Food sensitivities tend to pair with the gut health quite a bit, like what's driving the gut inflammation. So just more dependent on what they're struggling with, I think.
Yeah. So you had mentioned again previously, Doc, that there was a patient that they wouldn't allow them to order the testosterone testing.
Yeah.
So there's somebody that sees their PCP, they get their typical blood panel, but they still, technically they're normal, but they still feel off. They're like, something is still wrong. My primary care is not taking care of me. There's something wrong with me. What's kind of a concrete first step you would suggest people do besides looking for a functional health? What's something they can look at themselves?
Yeah. So one of the big things we say is normal is not optimal. And people see that range in the lab work, and a lot of times there's not an age variation. So testosterone is a great example of that. The range on the lab is like, depending on where you're at, like 250, 300 to like 1100. As long as you fall in this range, you're normal, right? Thyroid's another good example, but it's not age dependent. So it's like 18 to 90 on the age range. And so really it's a lab average. They kind of clip the 5% outliers and come up with these ranges. So what I tell people, hey, if we treat patients, not numbers. So if your numbers look great and you feel like crap, like, you got some more work to do. So that's what I tell them is like, hey, be an advocate for yourself, even though you might be in the normal range. Like, keep pressing, keep digging, and communicating that with your provider that, hey, I still don't feel quite right, because there's some more work to be done.
Yeah. So what do you feel so far in how you've shifted from conventional to functional medicine? What do you still feel is some of the main challenges that you as the functional medicine provider faces from what a patient is saying?
I would say trying to simplify things most of the time. There's a lot of folks that come in that have done some good stuff, but they're still looking for that one supplement or one med or combination just to fix all their issues. So a lot of times we'll have them stop half the stuff they're doing, and they're trying.
Yeah.
But they'll come in with a bag or two full of full of things. And, just hoping that the one thing that they try or see will kind of be the thing that leads to this kind of miraculous improvement or recovery. And it just doesn't work that way. So we really try to slow those things down and simplify and say, hey, let's go back to the things that are always going to move the needle the most: diet, lifestyle, sleep, stress management. And that's just hard to do because those are not quick fixes.
No.
And we want that immediate kind of thing, but it's so foundational. I love listening to Mark Hyman because I think he's right, because that's his foundational. I was watching something that was like, hey, I had this classroom full of people. I was like, hey, we got this new drug that cuts diabetes in half and insulin resistance and blah blah blah. And he's like, how many of you are interested in taking it? And they'll raise their hand. He's like, good. It's called food. And they're all kind of like, what? So it's just kind of it's a little bit of a mindset thing, but that's kind of how our world and society is like, hey, we have to always take this kind of thing and to fix everything. So a lot of times we cut them down and say, hey, let's get a little bit of a reset here. These things you've been doing aren't working. We tie that into maybe some of the genetic stuff we find, lab work, and then try to kind of re-look at pathways and where they may be struggling a little bit.
Mm-hmm. So to allow you to brag a little bit here, so what do you feel is a differentiator about you and your practice that isn't in your community? Like, what makes you better than the other providers that are out there? What do you do different?
I think it's the time, being able to schedule appointments. Like, I love going through the lab results. We try to do as many of them in person. I was just talking about this with someone the other day. He's like, yeah, my last provider would just send me an email saying, your labs look good. That was it.
Yeah.
Like, we pull them up on the TV, we go through each one, and we write a summary, like AI generated, after we're talking, like, so they can see that. And I want them to understand, like, what are these labs we're checking, these things you're taking, like, why are you doing that? So I think that's the first thing. And then, like, educationally, like, we spend a lot of time trying to get them to understand disease risk and gut health and what hormones are. We get, of course, a lot of discussions about the cancer concerns and, like, with hormone replacement therapy. And those are the things that I love to do, is kind of, provide some insight on some bad information that's out there, and some of the fear we have about fats and hormones and a variety of things like that, is just talking through and referencing and providing those things for people. And they're like, oh, I've always been told that. It's like, yeah, I was told the same thing. Even in med school, we were told the same thing. But when you're really digging the data, you can differentiate. And you mentioned earlier about the physicians, saying, oh, we don't do that, or I don't. We become very good as physicians about deflecting questions. And if you can't find a provider that says, I don't know, or I'm not sure, then they tend to kind of dismiss it. And the biggest thing is like, oh, there's no studies to prove that.
Right.
And so that's when I get into, like, okay, when people read studies or there's no evidence-based this and that, like, you probably know as well as I, like, there's very few, like, gold standard studies, like double blind, all that kind of stuff. Like, and then it just becomes like, does this make sense to me? And if it does, I'll say there are studies. And if not, I say, oh, there's no studies that prove that kind of thing, because they might be observational or, whatever the case may be.
Right.
And so that term is, evidence-based kind of stuff. What does that mean to somebody who actually knows how to read the research, like, and share that with patients? So I think that's one thing that physicians and providers are bad about, that they'll just discard it. So I have no problem saying I don't know. I say it quite a bit, but I'm going to find out, or I know somebody who does.
Right.
Is kind of my answer usually.
Yeah, and that's good. Unfortunately, we're hearing things as of late that what we've been told for a long time isn't true. What studies have been out there, we've been lied to. I think there's some money-driven factors behind that, and not to get into politics about it at all, but there's some of that driven behind it as well, which is unfortunate. So, when, like, for instance, the black box removal of VHRT for women, and, like, for how long have women suffered unneedingly because there was a reason behind it? So do you see in your practice both men and women as well?
We do. Yeah.
Mm-hmm. Okay. Who's your ideal patient to come into your practice?
I get asked that a lot, and I've thought about that answer, and I have a hard time answering it because I love the variety.
Yeah, good.
I'm not sure if we have an ideal one. I'm not sure if I want our practice to be an ideal. To be honest with you, you throw a little bit of the sports stuff in there, but we have a lot of teenagers. Like I saw a 14-year-old yesterday that has some inflammatory bowel issues going on, and his parents were frustrated at the children's because for the last year all they've done was increase his steroids. He's on like three different steroids, and they had pushed for some other testing. And they're, hey, we don't do that. That's not part of our protocol. And so we dove into some other questions and testing, and he wouldn't be our ideal or normal clients, but those kind of challenges to help people, to give them the information to use that additional specialty testing. Like, that's what I love about the functional medicine, is I feel like we can help almost just about anybody.
Hmm.
So I love the variety. Certainly the more common ones are probably the 30 to 50, fatigue, weight, just struggling with some things. But the different challenges are what keeps me interested in things I don't know about. Like, oh, let's dig into that a little bit and figure that out and add that to our tools that we can use.
Yeah. And I love how you answer that, Dr. Tomlins, because I can only imagine an orthopedic surgeon that is a knee specialist. And every day, like, what's new? Well, it's the right knee. What's tomorrow? It's a left knee. Like, it's granted, they all have their own problems. They're all unique. Not every knee that comes in is, but boy, to have the variation that you see, it keeps you up on what you have to do. You see such a vast array of patients. So I like that, how it's, you don't want just one that comes in, which is good.
No, we have an 11-year-old that I think is our youngest, and we have a 96-year-old patient. Those are outliers, of course, but that's just an idea of the range of folks. Everybody needs help at some point, so the age is kind of immaterial.
Yeah, absolutely. So from a business perspective, what's the focus of your business right now? Like, what are you looking to do in your practice?
I think I'm still trying to become a business person,
Okay.
even after 2.5 years, because I do nothing about business, to be honest with you, to be completely
Yeah.
frank. We don't learn any of that. The medicine part was the easy part as far as the transition. Um, and I went through the functional medicine academy for some training,
Nice.
and I chose that one over like uh, IFM and A4M, because they had such a bigger business and a training aspect to it.
Mhm.
And that's what I felt like I really needed the most, was those kind of things. So, I've learned a lot, per se, but it's just the ins and outs of, I still answer the phone for the most part right now. It's the billing side of things, it's ordering, it's scheduling, and how much time do we need for those folks. Just that whole aspect, and getting things together for a cost standpoint, and looking constantly at different meds or supplements that are less pills, not as costly for patients, but still get certified and effective. Like, that's a constant,
Yeah.
search for something better.
Yeah.
Probably never ending.
If a pharmaceutical company has anything to say about it, and or a nutraceutical company, they're always going to be making something new. They're always going to be
Always,
making something new.
always, yep.
So you mentioned a little bit about AI. How have you implemented AI into your practice?
Yeah, I would say that that's pretty recent. We've done it more from a dictation kind of standpoint. So, uh, trying to save time, as far as like, I used to fill out this paper on the summary. I made like a kind of a graph that would have like your level, our goal, and our plan. And then when the PDF of the lab results would come back, I'd try to kind of mark those up so people could understand it. And those things are great to help. It just a time consumer, trying to do notes after patients. And I think that's one thing that maybe patients outside medical maybe don't know a whole lot about, is like, you have a schedule full, your last patient, like when I was at the hospital, is at 4, like, why don't you have later appointments? Because I finished at 5. Now I have 35 notes to dictate
Yep.
because it is back to back to back to back to back.
Yeah.
And when the last patient leaves, your notes are just starting unless you can do some in the middle or over your lunch period while you're feeding your face and trying to dictate and get half of them done for the morning. So it's a very cumbersome documentation, and when insurance is involved, and you got to play that game a little bit and check the boxes, and so it's been really helpful to pick up an AI that has some medical knowledge, because some of the words we use in medicine or traditional AI has no clue what to transcribe or what we're talking, and then I can just go back, tweak the recording, and I think it saves me about 20 minutes or so per patient.
Oh, that's excellent.
And so, it's a good, hour and a half, probably on average per day that I can get back, get home to kids and family. And, that's a challenge for any provider, is leaving work and going home and being either a husband or a father or whatever the case may be, and not bringing work home. Because most of us probably could go home and work till 9 or 10 at night every night, phone calls or whatever, but there has to be some boundaries. And that's one of the big things I think that leads to a lot of provider burnout, is separating those.
Yeah, I think that's where an emergency room physician has it, where others don't, because when they're done, they're done, they go home. But, there's a lot of stress. There's stress in every aspect of medicine, but there's a little bit of stress, added to that. But yeah, it's no matter if it's as a chiropractor, my wife being a PT, you being a physician, functional medicine, the notes are what people don't understand. And as you one note, and you can't dictate as you've got, broccoli in your mouth. It's a tough situation to go through. So I'm glad that you're kind of cutting back on some of that time at what's taking that. I love, from a patient impact perspective, I'd love for you to share maybe a success story with us of a patient that's had a great results of coming in to see you.
Yeah. Gosh, there's a few. Think about one of the first patients that jumped on board was actually a good friend of mine, and he's like, "Hey, I'll be your guinea pig." When I had kind of told him I was actually a coworker of mine, order whatever you want. I got some, and the thing is, like, from the outside, you would never know. And I tell people, like, you look at this person, they say they're healthy because we assess that externally.
Yeah.
But inside, he was a complete train wreck, with all kinds of issues going on. And so we kind of started diving in, and, like, he had terrible gut health, couldn't ever, get that better. And, hormones were off, and still a wide variety of things. And so just to kind of see that his transition over the next 6 months, when we started, to where, he didn't have to run to the bathroom all the time, and, bloating issue, and actually got some of the best sleep. Like, I remember him calling me one time and said, "Hey, these last 2 weeks, I have slept better than I have my whole life."
Oh my God.
And it just kind of a reassuring, kind of reminds you of some things that why you're doing that, because he had like 5 colonoscopies before then, and EGDs and meds, and I tell folks with the GI stuff, like, hey, most of these are not structural problems. Like, scans, colonoscopies look for structural things, and they're a functional problem that you got to fix. And so once we were able to do that, and it takes some time, you can't change the whole guts or microbiome in a week or two that's been there for 4 decades already. So that's one that comes to mind for sure. That was kind of early. Him being a good friend, those are the people you always want to do better, probably more so, but or not go wrong. You don't fix something, like, it's tougher when they're your good friends, but that was a rewarding one for sure.
Yeah. It's good to see that when you were in the clinical setting, not your own private practice or the hospital setting, you again don't have the time to build that relationship. And what most people don't understand from a physician standpoint is you want to help as many people as possible. You don't always know if you've helped them, but when you have your friend or a patient that isn't a good friend of yours call you back and say, "I'm sleeping better, I'm eating better, brain fog is gone," you're doing that person, that patient good. If he or she is married, or they have a spouse or a partner or whatever it is, you're doing them such a favor. And that's a trickle down effect with the people around them. family, coworkers, they all get a better benefit when you're getting good results for your clients.
Yeah, you're right. I guess this another good point of the functional thing is we get to follow up a little bit closer on some of these things, more personalized to know if people are struggling or doing well. But the biggest thing I think if you can change someone's life like that, that's the best. Like they tell other people as far as growing your business and being reasonable from a business and not overcharging people and doing those things. Like, hey, if you fix somebody, that's going to be your best marketing that you could ever have. And, so that's such an important thing is, you know, using that to grow the business and kind of spread this word like, hey, we can be proactive about things because we're such a reactive medical society. Let's fix this before we even have a problem kind of approach.
Yeah, I love it. Well, I've enjoyed having you on. Just a few more questions here if we could, but if somebody's
Yeah.
interested, we're going to share all of your links, but if somebody wants to learn more about you, Dr. Tomlin, or your practice, Summit Health,
Yeah.
where could they find out more about you?
Probably our website. We do have some socials as well. So Summit Health, ks.com is the website. We also have a second practice in another location called Thrive MD. So it's www.thrivemdkc.com.
Okay.
And that's a practice I recently took over last fall. That's more of a direct primary care clinic, but the provider also did a fair amount of functional stuff. So those are the two clinics that we have. We do have socials for both of those, Summit Health and Thrive MD. So that's another good reference for information postings.
Okay, perfect. We'll make sure that we share those for everybody down below in the description.
Yeah.
And things like that. So 2 last questions. As a healthcare provider, what's one piece of advice you could give us all that would affect us in a positive health?
I think take control of your own health is what I tell people all the time. Like, don't wait for bad things to happen. Like, be your own advocate, do your research. I always say, I tell people, find your blind spots. That's what we're looking for. Because there's a lot of healthy people out there that have come in like, I really don't have any major issues. I just kind of want to know. We do some tests and like, it's just a matter of time. The body's an amazing thing and they've had some benefits, but be your advocate. If you don't feel good, keep researching, keep communicating until you find somebody that listens and can figure those things out. Because sometimes it takes a while to work through some things that aren't quite as common. So, keep being proactive, keep studying. And I love the people when they're like, hey, I've been doing this research. They'll come with these printout things. And, that's somebody that's really invested in their health. And those are the people that do the best.
They want to get better. Like an athlete
typically
wants to get better back out to perform. You want the type of patient that's willing to say, okay, I've got challenges, challenge me back. What are some things that I want to do? Versus the patient says, no, I think that's too hard. I don't think I can do that for myself. And then you're going to be stuck in the same body, same situation.
That's right.
Yeah. Last question for you, Dr. Tomlins. You've been a great guest on the Prime Health podcast here. What is your personal definition of Prime Health?
Oh man, my personal definition. I would say the kind of proactive approach or you're simplifying is my definition. I think that's, what goes back to the things that move the needle the most in healthcare. Diet and lifestyle are always more than any medication you can take, more than any supplement you can take. Like, assess what you're doing in diet, lifestyle, sleep in particular. And that's my definition. If you can improve those, then, primal health is kind of a place you'll probably wind up being.
Yeah. Love it. Well, thank you for sharing that. And thank you for being a great guest, Dr. Tomlin. It's always a pleasure when you get to learn a little bit about the person individually and about the practice. And I think that your patients have a benefit what others don't. You're an active individual, you're healthy, not that other physicians aren't, but you came from a sports setting, you came from a family of health with your father being a chiropractor, you going in and working and then doing your sports medicine with Dr. Andrews and his company. You have a step up from a majority of the people that are out there. And you realize I enjoyed that, but the corporation aspect of healthcare wasn't for you. And you took that leap, like you said, you went into doing your own functional medicine because you realized, hey, I'm having some questions about my health. that's usually when people get the greatest results for their patients, when they've unfortunately had to suffer through something themselves and had to find that. So they want an answer themselves. So I appreciate you sharing that information with us. And for sure,
Yeah.
we love it when, our guests that are listening and are watching, if they would subscribe to it. But I always tell people, until next time, remember that true wellness is a journey we are all on together. So whether you are in charge of your own health or guiding others in theirs, every step forward matters. So please do stay committed to your Prime Health journey. Again, Dr. Tomlins, thank you very much for being a guest on the Prime Health Podcast. I really appreciate it.
Yeah, thanks for having me.